waiting. So he starts sharing. We are live. Good afternoon, everybody, and welcome to the VII BRICS Conference at the University of São Paulo. My name is Priscila Cotarelli, and I'm a researcher at the VII BRICS Center, and I will be mediating today's roundtable. Today, our speakers will talk about a very important topic, global health among BRICS countries. Joining us in this panel is Dr. Anviti Gupta, Dr. Jaskaran Sait, and Dr. Josephan Freire. Soon, Dr. Vika Sait will join us as well. Before we start, I would like to thank our sponsors, Ibra China and Miguel Neto Advogados, and also our supporters, LIDE China, SABYA, and FGS. Without them, this conference will not be the same. Also, in the YouTube comment section, you will find the present list. If you want to receive an official certificate from this conference, don't forget to fill it in. Last but not least, the comment section is open for the public. You can ask questions to our distinguished guests and interact with other members watching us live. In the name of VII BRICS and Professor Paulo Casella, I would like to thank you for your presence. I hope you enjoy our debate. I will now present our first speakers. Dr. Jaskaran Sait is the Dean Research and the current head of the Forensic Science Department at Gita University, India. He held the Inspire Fellowship for pursuing doctoral degree from the Ministry of Science and Technology from the Government of India and completed his PhD at Ahmed University. He believes in a multi- and transdisciplinary approach of extensive research leading to several patents, copyrights, and books. Dr. Jaskaran Sait received honorary professorship from ISPTEC from Angola and the fellowship FSSIERSP from the Society of Innovative Educationalists and Scientific Research Professional from Malaysia. Joining him will be Dr. Vika Sait, who is founder and vice-chancellor at Gita University, India. He is a very passionate teacher and has positively impacted the career and life of more than 5,000 students directly in his classrooms over his 25 years teaching career. He is a TEDx speaker, author of the bestseller category education book, Paper to Screen, The Future of Education, and holds 2 patents, 3 books, 3 award-winning case studies, and more than 30 research papers. Dr. Vikas has been honored with several awards, including the Best Academician Director by the Indian Today, and recently, the Vice-Chancellor with Outstanding Contribution towards Students' Employability and Career Development by Armador Common Media Group. Prior to Gita University, Dr. Sait was Vice-Chancellor at ITM University, Raipur. He also worked with Amity University, Chandigarh University, and ITS, the Education Group. Both of the doctors will be speaking about the opportunities and challenges of artificial intelligence in healthcare. Doctors, you have the floor.
Yes. Thank you so very much, Priscilla, for inviting in this such a wonderful platform, wherein the BRICS, all the countries which are involved in this particular BRICS, are joining in a one particular platform, and we are discussing many issues related to the healthcare and the challenges and opportunities which are being involved in this. And if I talk about my country, that is India, so I will be discussing a very, very, very booming topic which is very prevalent nowadays, that is artificial intelligence. And what is artificial intelligence, and what is the repercussion of artificial intelligence in healthcare? So my today's topic, artificial intelligence in healthcare, the opportunities and challenges. And Foremostly, I would like to, introduce my founder, vice chancellor of Gita University, who will be joining very soon in this particular presentation. And he has, as Priscilla has already, discussed his biopic, that he is a renowned man in his field, and he has done a lot of credentials and in his particular, career. So here in this presentation, it's very, very important that what is actually artificial intelligence. Why? Because the technology is increasing, and with the increasing technology, we have to update ourselves. So technology is a boon or it's a bane. So it has to be studied. And if we talk about our broad theme, which is the healthcare, so how this artificial intelligence is being, rooted out or applied in our, healthcare industry. So here my talk will be on artificial intelligence in healthcare. What are the challenges and what are the opportunities which are being involved in this? Now, coming from the basics or fundamentals, we should very first know that what is actually artificial intelligence. So artificial intelligence is nothing. It's the simulation of human intelligence which is being processed by various machines or the softwares. It's very, very important that it's the intellect which machine or a software is being doing. We are giving the inputs and we are getting the outputs. So the human intervention is there, but it is being artificially, designed. Now, here in this particular presentation, I will be discussing the various types of various AI models which are being involved in artificial intelligence, and how these artificial intelligence models are being applied in healthcare industry, and what are the opportunities of these AI models in healthcare industries, and what are the challenges. So this will be, discussed in this particular platform of BRICS, and what is the, the status of the artificial intelligence in healthcare in our country. So I will be discussing all these particular aspects in this presentation. So if I talk about artificial intelligence in healthcare, as we all know, it's being involved increasingly, and it's very prevalent in business, in societies, and that is being, now being applied to various healthcare industries. Now, these technologies are, have a potential to transform themselves with various aspects in the terms of patient care, in the terms of administrative processes, in the terms of pharmaceutical organizations, and for diagnosing diseases. Yes, it's a boon. Why? Because it's ease for us to, prudently and proactively, you can say, find out or to investigate these particular potential of transformations. Next slide, please. Yes. So now if I talk about that, what are the various types of artificial intelligence models which are being relevant to healthcare industries? So the very first, it's machine learning. We have various, neural networks and deep learning methods which are being there, and how these are being applied in healthcare industry. I will be explaining this in my further slides. Then I have natural language processing. Then I have rule-based expert systems. Then I have another type which is physical robots. Then I have the last type, that is robotic process automations. So these types of AI which are being relevant in healthcare industries will be illustrated and demonstrated in this particular platform of BRICS. Next slide, please. Yes. Now, if I talk about very first, that learning. So machine learning has two aspects. It's a learning, it's a software, or it's a algorithm which is being designed by the software professionals or the computer experts. And these software or the computer experts which are being, which are utilizing their brains or the minds to develop various, applications. These applications are known as neural networks and deep learning. These are the machine learning languages. So if I talk about what is machine learning, it's a statistical technique actually, which deals with the models to data and to learn by training models with data. So what we are doing in this particular machine learning models, we are having a data and we are capturing that particular data, we are collecting that particular data, and on the basis of that collected data, we are training and we are developing algorithms. And that algorithms are being further utilized for various applications in healthcare sector. Now, if I talk about the subtype of machine learning, that is neural network, which is a technology that is categorized in healthcare applications for determining whether a patient will acquire a particular disease on the basis of the data. That is variable or features. Now, I just want to ponder a very important aspect in this particular model of machine learning, that is, what is actually data and how to find out that a person is having this particular type of disease or not. So if I talk about the, the technology advancements, if I talk about the, you can say, the emergence of the computer or the softwares or the digital era, so the very foremost important thing is the artificial intelligence. Now, for example, there are various algorithms which are being made, there are various softwares which are being made to identify that whether the person is having this kind of dermatological disorder or dermatological disease by scanning their nails. So if I have a nails, so I can scan my nails, and after scanning my nails, I get acquainted that whether that particular, person is having what type of dermatological disorder or a disease. So this is the revolutionary change or the advancements which are being made in healthcare sector, which it's just an instant, or it's just an example which I have portrayed to you, that on the basis of nails examination, we can identify the disease, especially if I talk about dermatological diseases. Next slide, please. Yes. Next comes to natural language processing. Now, what is this natural language processing? Now, this natural language processing is understanding, creation, and classification of clinical documentation. Now, for instance, we doesn't know. Now there is a boom of ChatGPT and various other softwares in which we are just there to speak or write one sentence, and we are getting a full text of that particular topic. So likewise, there are various utilization of these natural language processing in AI sector of healthcare. Like for instance, if a person coming from the country like Arabic country, or from Europe, or from Middle East, or etc., so they are coming to get for to cure some diseases or to cure their healthcare and all, they are migrating from one country to another country for better medical facilities. So what they are doing, the various packages or various AI models are being developed, which are being illustrated to them in their own languages. Like for example, if I am a doctor, I don't know how to speak Arabic. So what I'll do is I have various AI models by which I can illustrate that what actually I want to say for that particular patient to that of that particular relative. So these are being foremostly illustrated in as a natural language processing. Now here I just want to highlight very important aspect, that is it helps to, or it prompts to analyze unstructured clinical notes of the patient on patients. They help to prepare reports, specifically if I talk about radiological examinations, and they transcribe patient interactions and conduct AI conversation. Now, for example, like we are using various softwares like Liberate, we are using Practo, and there are various other softwares. Now, if I have any particular problem in particular disease, I don't want to go to certain clinical doctor and all. So what I can do is I can directly call doctor. I can fix an appointment. It's a transformation which is known as telemedicine, and which was very prevalent in COVID-19. in 2020 or 2019. So this telemedicine is a very important aspect. And I just want to share a very important aspect that in 2020, I have published one research article in collaboration with Alexandria University in Cairo, Egypt, wherein we have done a survey and we have done comparison of India and of Egypt. So what we found, the satisfaction level of telemedicine across the healthcare practitioners was quite high in both the aspects. There were various factors which were involved. If I talk about the factors like, the time, the availability, and the processing. So there are numerous types of factors which were involved. But after comparison and after statistical analysis, we found that the doctors were quite satisfied when they were using telemedicine models. So this is the transformation of artificial intelligence in healthcare industries. Next slide, please. Yes. Now the third type of AI in healthcare industries which are being routinely used is physical robots. Now this is the data which is being recovered that surgical robots initially approved in USA in 2000, which provide help to surgeons. Yes, there are robotic surgeries, which is very prevalent and which is making an ease for senior surgeons to conduct heinous surgeries, or to capture or to find out that what type of malfunctioning of the disease is being there. So physical robotic surgeries is very prevalent and this prevalency is a boon. Yes, the intervention of these physical robots cannot replace the clinicians or the doctors, but it aids them. It provides certain ease or certain, the relaxation to perform certain surgeries. This not only has improved the ability to see, to create, and to precise, various minimally invasive incisions and to stitch wounds. So these are being, diagnosed. Like for example, if I have an injury, now there are various certain AI models. Yes, it's artificial intelligence models which are being, transformed or which are being developed to find out the accuracy that if I have one particular type of injury on my skin, so what type of, ointment or what type of surgical aid you have to give to remove or to cure that particular injury. So this all is being, predefined, or you can say prudently or proactively being, you can say analyzed by various AI models. And these AI models are very proactively working in finding out that what actually was the cause. If I talk about medical legal injuries, like since I am a forensic expert, so in the forensic expertise, we receive various medical legal injuries. So these AI models, this is the research which is being, it's basically a research which is under trial to find out that what medical legal injury is this, whether it's a artificial contusion or whether it's a true contusion. Contusion is a bruise. My friend Jose Ferran, a medical doctor, he might be knowing that what is artificial bruises and normal bruises or a true bruise. So AI models are being developed to find out or to illustrate the opinions that whether this particular type of injury is artificially being created or it's being just, natural. So these AI models are revolutionary, changing the scenario, or they are aiding in various law enforcement agencies also. So this is very, very important. Next slide, please. Yes. So the last AI model which is being which is utilized in healthcare sector is robotic process automation. Now, these are just the computers, or these are just the computer programs which are being attached, or which are being commanded by various servers, and these are being repetitively utilized for various authorizations, updating patient records and billing. There are various softwares which are being used in various hospitals. There are various softwares which are being developed or which are under trials to get benefited for patient care and for other mutual, you can say, the utilization factors which are being involved with the patient and with the hospital. So these particular softwares will not only help to make convenient for the patient care and patient's ease, but it also helps to various administrative processes of the hospitals to transform the local billing or local patient records sectioning into a digital way. So these are being very prudently involved, and these particular things are being automated by various AI models. And this type of automation is also utilized to find out the images. We have various radiological images which are being demonstrated. We go for CT scanning, we go for various MRIs, we go for various PET scans, etc. So these AI models, what are these? These are the softwares, and these softwares are being trained, and these trained softwares are being utilized to find out that what actual the disease the person is having. So these all aspects, or these all, you can say, the development of the softwares is very, very helpful for further processing, further diagnosing, and further prognosis of the diseases by various radiologists. So it's a boon, and these opportunities will sustain the various, you can say, the sectors in healthcare or the branches of healthcare to get benefited in various factors, like for the patient care, secondly for the employees which are being involved in the hospitals, and thirdly the society. Now, if I talk about the challenges, yes, very true. Indeed, it's a very important to discuss here in this particular platform. We have various challenges. Why? Because there are pros and cons for each and every state, or each and every phenomenon, or each and every model which are being utilized for various sectors. Now, if I talk about the challenges which are being faced by AI in healthcare industry, so that is first, which is very important, known to be as ethical implications. Ethical implications is very, very important. And these ethical implications not only, helps, or not only, make us aware about the confidentiality of the patient's information, but it helps to have the professional secrecy. So these ethical implications is a major challenge in artificial intelligence models for healthcare industry. Then second is the biasness or the interpretation. The developed model or the algorithms which are being made to diagnose certain diseases may vary. Why? Because that is artificially trained models. Artificial intelligence is the artificially trained models. So we can loophole, or we can find out, or we can tint it out that what type of artificial intelligence models can be revamped in what direction. So this is up to us. So algorithms can be biased. And why these algorithms are being biased? When it's very difficult for us to explain that what actually the radio image which we have received, or which the scanned image which we have received, that whether it's a cancer or whether it's just a cyst, it's a tumor or it's a cyst. So these implications is very difficult and very, you can say extraordinary to explain. The next major challenge which we are facing is the likelihood of disease on the basis of gender or the race, when those are not actively causal factors. Now, what does this mean? This means that yes, artificial intelligence means that we have to train the models. We should have a good number of, prudent, or you can say the active data. And that active data needs to be strictly followed. And this on the basis of this active data, we are designing the algorithms, we are developing the AI models. And sometimes, if I talk about law of individuality, we all are unique. Even the DNA of homozygotic twins is not perfectly, similar. So when these aspects are being coming around, so AI plays a very important role, and it's a major challenge that whatever data we are, putting or we are inserting in our model, on the basis of that data, we are getting the resultant factors. So exceptions are there, and we have to accept the exceptions. So more and more proactively or prudently you are developing the AI models for healthcare industries, more and more robustness and ruggedness will be there in our algorithm and in our AI model. So it's a slow pace study, slow pace examination of various AI models which are being developed for healthcare industry. Next slide, please. Yes, another challenge, that is acceptability. It's very true. Yes, it's important that whether the AI models which are being developed are being accepted by various governmental and regulatory bodies. So that's a major challenge. Why? Because here artificial intelligence is being involved, and this artificial intelligence may be, rectified, or it may be, can cause certain, implications of biasness or certain technical glitches or certain, you can say, the malfunctioning or certain veracities. So these are being involved. Now there is a very important concept of hacking. The data can be hacked. True. If I have been involved in developing AI models to detect certain or to diagnose certain disease, so it may hacked. Hacking is a very prevalent factor which is being there. So these are the certain challenges which are being involved in AI for utilization in healthcare. Last but not the least, that is data veracity. We all are unique. I am unique. My parents are unique. Yes, it's a genetic factor. It's all dependent on the gene pool, but we have veracity. And that veracity is very countable measure to find out the person or to find out the disease. So we cannot accumulate each and every veracity in one single, algorithm. So we have to train the models. We have to, be very judgmental while training the models. We have to inculcate all the veracity features or the variables in one particular set of data, which is being included or inculcated in the AI model which is being developed. So these are various important challenges which the AI in healthcare sector is facing. And this is very important. Next slide, please. Now, summing up, I conclude that AI systems will definitely not replace human clinicians. Yes, it's true. Why? Because it's only we have made the AI systems. So human intervention is still there. Though the software or the computer will be doing this, but yes, the human intervention is still there. They are just the scales, or that is just the intervention, or they helps to aid in diagnosis, in prognosis of the diseases, in order to find out the various medical legal examinations, etc. But they will never replace the human intervention and human clinicians. And this is a very augmented factor which is involved in the efforts to care of patients. So we cannot play with patients. It's very, very important. So healthcare industry is very vigilant industry. Why? Because we are dealing with live humans. So it's very, very important that we have to be very vigilant. We have to be very proactive. We have to be very, 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 procrastinated in the way to develop the models. Why I'm saying procrastination? Why? Because data veracity. We don't know that what kind of genetic mutation may occur. It could be genetically, it could be acquired. So the revampation or modification of the data is specifically being involved. And this AI is a dilemmatic. Many of the practitioners may say that it's a dilemmatic situation, whether to say it's a boon or it's a bane. But yes, it helps or it aids in investigation, or to find out various or to write or to prepare clinical reports. So in the end, I just want to thank that this is a very hot topic, and I think this hot topic is very prevalent. And nowadays everything is being going, we are talking and we are listening about AI. To whom we are talking, it's all AI. AI is in business, AI is in economics, AI is in education sector, AI is in textile industries, etc., etc., etc. And now AI is in healthcare too. So what are the repercussions of these AI models in healthcare industry, and what will be the impact of these repercussions to the patients? Why? Because as a doctors, it's our prime responsibility to take the care of the patients. So thank you so much, the organizing team, all the sponsors, and my friend Jose Nantala, and the organizers of this BRICS conference. So thank you so much. I have taken, I think I have a time, or the time is over?
Right now the time is over.
Okay, the time is over. I was thinking, actually, Priscilla, I was thinking that, I have made only 13, 14 slides, so I have ample of time. But I tried my level best to, investigate or to, apprise about the certain challenges and opportunities in healthcare industries on the basis of AI. So thank you so much. I think Dr. Vikas sir will be joining very soon. So he will be there for 5-10 minutes. So you may proceed. So I thank all my, colleagues from my country and from Brazil, especially Priscilla and my brother, Dr. Jose Ferran, who is my lovingly brother. I was there in Brazil only because of him. He invited me and we have enjoyed a lot. So thank you so very much.
We thank you for your very insightful panel and debate. It was very interesting to know the implications of technology in healthcare and how all these new features and instruments are going to help improve medicine worldwide. Thank you so much for that. It was very interesting. And now we'll go on with, yes?
Thank you so much. Thank you so much.
It was indeed a pleasure listening to you, Dr. Jaskaran.
Thank you so much, ma'am. Thank you so much. Thank you so much.
And actually, we already welcome here Professor Anviti Gupta. She is our next speaker. She is an accomplished innovator and leader, a seasoned academician and a behavior trainer and counseling psychologist with 27 years of experience in academics and administration in the university education system. She has inculcated effective human management skills. She has excelled as the founder and rector, vice chancellor of Sharda University, Uzbekistan in 2019. Currently, she is the Dean of School of Humanities and Social Science at Sharda University and a professor of psychology. She holds a PhD in psychology from the University of Lucknow and is a certified clinical hypnotherapist from the Californian Hypnosis Institute from the United States and from ICA Institute, India. She has designed, developed, and conducts training programs for various organizations and has authored and presented several research papers at national and international conferences and has published extensively in Indian and international journals of repute. Professor Gupta's intervention is about exploring the mental health landscape in BRICS nationals with a spotlight on India. Please welcome Professor Anviti Gupta. You have the floor. Thank you.
Thank you so much. And first of all, I'd like to extend my heartfelt gratitude and thanks to the organizers of this 7th conference of BRICS in the University of USP. And it really gives me immense pleasure to be a part of this panel discussion where all the luminaries from the distinct fields have come and put forth their points, which are very valuable, very valid, and it's definitely going to be a wonderful learning experience. So let me just start with my presentation. My basic focus of today's discussion is based on the exact mental health interventions. It is basically on how mental health is viewed, what are the interventions which the government, the state government, the districts, and the different countries of BRICS are taking few steps to combat with the various mental health issues, specifically after pandemic, which has broken the families, broken the people's peace. And mental health has not been given that importance in the various conventions like G20, G7, as well as in BRICS. Mental health has been fleetingly discussed, but it has not been given that due weightage, which actually we should have given. So I'm going to highlight certain statistics that why it has become imperative for the nations to look very, very seriously towards combating this pandemic, which is called mental health, and which is disrupting the lives, which is disrupting the productivity in these nations. Over to my presentation. I'm sharing now. Can you all see my presentation now?
Not yet.
Not yet. Yeah. 1 minute.
If you prefer, I can share it in my screen and then I pass the slides to you.
Yeah, I think you can do that. That would be fine. Okay. Perfectly fine. In comparison to Dr. Jaskaran, I think I have many, many more slides. I really need to hasten up my presentation.
You can start. The slide share is on screen.
Okay. Okay. Wonderful. Let me just... Can we have the... So basically, my topic for today's deliberation is exploring the mental health landscape in the BRICS nation? What is the state of affairs? What the various surveys states about Brazil, Russia, India, China, and South Africa and other countries? And what exactly is the state of affairs in India? So when we talk about health, it is mental health which is fleetingly discussed in various panels, and not much of emphasis has been given to it. So let me first explain what exactly we mean by mental disorders and mental health. The mental health basically is an important component of human development. It deals with human ideas and emotions, and actually it leads to a good life by paving the way for healthy minds. And you won't believe that the absence of a healthy mind is a hindrance to personal, societal, and national, economic, political, and the entire social functioning of the world. No matter how much technological interventions happen, no matter how much technology comes in, but if we fail to take care of the well-being of the human beings, human souls, human arts, we will fail in all our endeavors, no matter how technologically sound we are. So mental disorders, basically, when we talk of disorders, it is associated with distress, which leads to complete impairment of human functioning. World Health Organization in 1978 has defined this mental health as a state of complete physical, mental, social well-being, which is not merely the absence of disease. So if you say somebody is not suffering from mental disorder or disease, that he is mentally healthy, no. It is something over and above the absence of a disorder. Next. It is imperative and very important that we maintain a positive mental health by treating all the people with poor mental health conditions, because it is very, very crucial in stabilizing constructive behavior, positive emotions, and good thoughts. Mental health again is important because it empowers to face the challenges and come out unscathed from those challenges and manage meaningful relationships. When we take care of the mental health, it doesn't improve our daily functioning, but it also helps us control our physical problems, our mental problems, our spiritual problems, and also our problems pertaining to relationships, both in personal life as well as in professional lives. Next. Now, the most important thing is, in order to identify that what is the impact of these mental disorders in the global world, we really need to see that what is the global burden of these mental disorders. If we understand and identify that it is really impairing the life of the peoples all around us, I think we really would need to do a lot to combat this. Now, in 2016, it was stated, the statistics says that mental and addiction problem affected about 1 billion people globally in 2016. So this is a burden of mental disorders in the globe. The second point says that the statistics mention that out of 10, 4 people in the world population will definitely suffer from a mental disorder or a disease at some point in their lives. The next point, which I really want to emphasize upon, is that mental disorders are responsible for 7% of the global disease burden measured in dailies and 19% of all years spent incapacitated. I would like so that people should understand what exactly is daily, is Daily is basically disability adjusted life years. Say, for example, if a person has schizophrenia or cancer or any other problem at the age of 18 and dies at the age of 20, the average life expectancy is 74.5 years, almost. So, this particular disability adjusted life years is around 55 years. So, total years of life lost due to this kind of mortality and the years lived with disability is going to be very, very high. So, mental disorders are responsible for 77% of this global disease burden, which was measured in dailies. The next slide, please. Now, another useful statistics which would definitely help us realize the need to pay attention to the mental disorders or the mental health across the globe is that 970 people worldwide have a mental health or a substance abuse disorder. This data was given in the World in Data 2018. Anxiety, people face a lot of anxiety, a lot of pressures, because when they come and encounter the stresses of life, they have a lot much of anxiety. And they say anxiety is the most common mental illness in the world, which affects 284 million people. The another point which I would like to lay emphasis on is that globally, mental illness affects more females, that is 11.9% than males, which is 9.3%. Another point is that major depression, anxiety, alcohol use disorders, schizophrenia, bipolar, dysthymia were identified as leading cause of disability in the United States of America. See, when it is being identified as the major cause of disability, the people have gone totally out of work. Their lives have been derailed. The major causes were mental disorders. The mortality rate of those with mental disorders is significantly high, which is higher than the general population. It is also estimated that the mental disorders are attributable to 14.3% of deaths worldwide, or approximately 8 million deaths each year. This percentage is very, very high. Next slide, please. Yeah. This is something, this pie chart signifies that what are the major mental disorders which have really incapacitated people's life, which has actually called as disability adjusted life years. Depression is the major chunk which incapacitates people. Then comes anxiety disorder, drug use disorder, alcohol use disorders, schizophrenia, bipolar, pervasive development disorders, which is 4.2%, childhood behavioral disorders is 3.4%, and other mental disorders are 2.4%. This data specifies that because of certain mental disorders, people mortality rate goes high. They die early because of these disorders. If they are not treated, if they are not nipped in the bud, whatever is the etiology, but if they are not attended to, they are not diagnosed well, they are not treated on time, it might result into this kind of losing their lives. Next slide, please, Priscilla. Now let's talk about all these countries and what statistics says about Brazil. The prevalence of emotional and conduct problems, that is the behavioral problem, the dispositional problem of the people in Brazil is around 10 to 20%, which is representing a significant burden of disease. So it is quite high a number, a higher percentage, and we really need to see what best can be done regarding this. Again, the statistics says in Brazil, 90% of mental disorders are non-psychotic disorders. And such disorders, due to their high prevalence in the general population, are usually called the common mental disorders. Now, these common mental disorders are also very high in Brazil. Among adolescents aged from 15 to 18 years, from these many places in Brazil, whose common mental disorders prevalence was 28.8%, which is again a very high number. Next slide, please. Yes, China. China is always technologically working well, and the environment demands them to be always on toes, innovating new things, inventing new things, and that is where the stressors come in. And that is why the statistics is very, very alarming in China. They say that mental health is the major problem of public health concerns in China due to large number of patients and the significant social and economic costs, which is burdening people's life and creating havoc in their mental arena, causing them mental distress. In China, again, the statistics says that mental disorders and substance use disorders accounted for 20.29 million and 5.76 million disability adjusted life years in 2019. Results from China Mental Health Survey, which was conducted in 2013 to 2015, it revealed that 12-month prevalence rate of mental disorders among Chinese adults is 9.3%, while the lifetime prevalence rate is 16.6%, which decreased slightly but remained at a higher level. Ma et al. In his research has stated these kinds of statistics, which is quite alarming. Next slide, please. South Africa, again, the burden of the mental disorders has grown over in the past 20 years in South Africa. South Africa's Ministry of Health publicly committed to increasing by 30% the number of people screened and treated for mental health disorders by 2030, which is quite encouraging. And if it is done, that I think the mental health of the people of that country would definitely be better. Next slide, please. Priscilla, next slide. Yeah, Russia. So we are talking about the BRICS nations, and I'm going to come to India primarily from the place where I belong. So the prevalence of major mental disorders in Russia registered in psychiatric institution has reached to 2978.7 per 1 lakh population. It is a huge number. In Russia, the problem of mental disorders in primary care is becoming more and more serious, such that the present some 25 to 30% of primary care patients need a psychiatric consultation. And of course, the suicide rate in Russia is one of the highest in the world. If people's depression, anxiety, other behavioral problems, their stressors are not taken care of, then of course this rate is going to go very, very high. And there is an increasing trend of 20% of people which are diagnosed with mental disorders in Russia. Now let's come to the next country, which is, now we've talked about the Brazil, the Russia, and South Africa and China. And what exactly is the impact of this mental health problem and the suffering of these people in the BRICS nation? Mental health hazards gives birth. So it is basically a spiral model which tells that these are the cause as well as the effects or consequences of mental health. Poverty gives birth to mental health problems, and also if people is mentally not healthy, then they will not be able to be more productive. which would lead into poverty. So this spiral thing says that if people are unwell, they are having this kind of a communicable disease like HIV, AIDS, then of course their entire life cycle stages would be indulged into caretaking. They would be incapacitated. They won't be more productive. Their relationship would get hampered. And of course, this will affect their mental health. And if it affects their mental health, again, it gives birth to poverty. People with certain diseases also are becoming used to substance abuse. Dehumanization, violence, crime, they are the outcomes of the mental health disorders. Or if people, because of this, so this is both a cause and a consequence. So all these factors, mental health, poverty, HIV, AIDS, dehumanization, violence, and substance abuse, they all are the causes and the consequences of each other. So we really need to treat, it's imperative that we treat the mental health issues and bring out new policies and collaborative issues so that we can handle them best in our BRICS nations. Next slide, please. Well, now comes the land from where I come from. This land has a lot of stigmas attached to the mental health problems. People are very superstitious when we talk of mental health problem. In India, basically, mental disorders are one of the primary etiologies of the non-fatal disease burden in the country. India had 197.3 million, that is 95%. It is very, very alarming, my dear panelists, and we must do something about it, that 95% of the total population, that is, they are the people with mental disorders, which is accounting for 14.3% of the country's total population. So imagine the chaos in their minds, imagine the chaos in their lives, imagine the poverty level going up, imagine the unemployment because of the mental disorders, relationship, crime, everything is going up because the mental state is not being managed, monitored, diagnosed, and treated well. In 2017, mental disease accounted for 4.7% of total dailies in India, which is compared to 2.5% in 1990. I mean, this state is very, very alarming in my country. Next slide, please. Yeah, across the Indian subcontinent, this particular graph states that, I hope I'm on time. How much time is left with me, Priscilla?
About 10 more minutes.
Okay, then I'll be able to complete. Fair enough. So this is basically across the various states. It is quite visible that down south in Indian subcontinent, the prevalence of mental disorders is very, very high. There could be many reasons, because this is the place where there is Silicon Valley, where a lot of IT hubs are there, where people are all the time working 24/7, and they are in complete stress all the time. That is why there is a rise in the mental disorder, or the mental state is pretty bad in these areas. So this is kind of a prevalence in different states in our country, in India, and majorly depressive disorders are more in down south and less in northern part of the country. As far as anxiety disorders are concerned, it is majorly, again, back in down south, it is major. The prevalence per 1 lakh is 3600, which is majorly in Kerala, where the literacy rate is the highest in India, but still the anxiety disorders are also high in the Indian subcontinent. So this particular diagrammatic representation shows that how depressive disorders are spread and in what percentage they are spread in different parts of Indian subcontinent. Second one shows the anxiety disorders. Next slide, please. And the third shows the developmental intellectual disability disorders, which are majorly more in the state of Madhya Pradesh, Uttar Pradesh, Bihar. Somewhere in central to northern India, the idiopathic developmental intellectual disability disorders are more. And it is the least in Kerala, where the anxiety disorders are more. And this kind of developmental intellectual disability disorder is less. So this is the state of affairs in the Indian subcontinent. And it is very alarming, and government is doing a lot, but still more steps needs to be done. Next slide, please. See, when we look at the mental health in India, there are various conditions, various environmental conditions, various genetic factors, various developmental factors, various political, regional, cultural factors which are involved, and they contribute to the mental health of India. So while we are talking about the mental health in the Indian subcontinent, we really have to see that the poverty is very high in India, and poverty is related to mental health. People are unemployed and they are below the poverty line. Large number of children are exposed to various problems, issues, challenges, adversities, and other diseases. Especially the reason because the population is very, very high in Indian subcontinent, and the resources are little less than it is required. And that is why people are exposed to various adversities in Indian subcontinent. Yes, the third contributing factor is the number of unemployed people who have become immobilized by their circumstances. And people who are not working, who are unemployed, they become poor. And then, of course, it affects their psyche, and their mental health will deteriorate. So, all these are the contributing factors. And the stigma, the discrimination, and the socio-economic inequalities are very, very high in the Indian subcontinents. And because of all this, because of unemployment, poverty, no bonding in the family, socio-economic inequalities, the rates of crime and violence increase in the Indian subcontinent. So they all contribute to the ill mental health of the people of the India subcontinent. Yes, next slide, please. Like, there are two concepts of outside in and inside out, which basically means that there are certain factors which are pertaining to one's genetic makeup. So the etiology of mental disorders lie in our genetic makeup, like schizophrenia. There are many diseases where the etiology is your genetic makeup, the chromosomal aberrations, and so on and so forth. But then there are social determinants of mental ill health. The social causes, the cultural causes, the economic conditions, they impact the mental health. And that is called as outside in. So they are affecting the mental health of an individual, and these are the external or exogenous factors which impairs the people's mental health. Another could be the mental health determinants of socio and economic development would be that is the internal world of a human person or internal psyche is damaged. People carry hurts, people carry jealousy, people carry negative emotions, people are, their personalities, their psyche is marred due to various kinds of abuses they face in their childhood, discrimination they face, they are not being given that due love, attention. So because of all of that, there are hurts, there are pains, there are breakups, there are unhealthy parental grooming of the child. They injure the person from inside, and they do not go anywhere. They remain there inside the subconscious mind of an individual, which results It has to come out, and it comes out in the various forms of various psychosomatic disorders. The mental unhealthiness is a resultant of all these. Okay, so I would just like to conclude. I've been given a reminder. So these are the basic causes. My next slide, please. I would just wind up, give me 5 minutes. So there is a Mental Health Care Act of 27. It has tried to work well for taking care of basically the mental disorders. And the major contribution is of this act is affordability, accessibility, and availability of the mental health care for the people suffering from mental disorders. Next slide. I will just next. Next. So these measures are there, and of course we really need to think about the WHO has given this kind of a pyramid wherein we say that self-care, informal community care, primary care services for mental health, these are the ones which really need to be kept in mind. This is kind of a model for self-eye care given by WHO. If these things are provided, if people are made aware of the self-care, there is an informal community care initiatives, primary care services for mental health, I think we will be nipping these mental health disorders in the bud, and they would not be going to the other levels wherein the treatment becomes costlier and the resources are very, very scarce in the Indian subcontinent. The next slide, please. So this is how the Indian, this is the last thing which I really wanted to showcase here was that in India, because people are uneducated, unemployed, and they are not aware of mental health issues, and that is what was the need why I'm talking about mental health. People are totally oblivious that why it is important and imperative to understand mental health issues, what are the causes, what is the etiology, and what are the facilities provided to take care of this. Is there's a lot of awareness should be done of these symptoms. People should be told that rather than on relying on those kind of faith healers, they really need to seek help from the specialized doctors and specialized clinics. The diagnosis has to be made, the treatment has to be started, and people need to adhere to the care. And finally, what we need to do is we have to rehabilitate these people who have had once suffered from various mental disorders, that they go back to the normal lives and go back to the society and they become self-reliant. Then a lot of initiatives have to be done by these doctors and the policy makers and the government. Next. This is the plight, this is the condition of human resources and mental health in India. It's only 0.75% in this population are psychiatrists, clinical psychologists. So we really need to emphasize on this kind of a psychiatric help or people with counseling diplomas. We really need to enhance our education system and impart certain knowledge to these people, and they become the healers and the counselors and the psychologists. Next. The way for this is, if you permit me for 2 minutes, I'll just have one or two. May I? Or just
1
so
minute.
effective. Okay, so effective implementation of national mental health programs like national mental health programs or district mental health programs in India need to made robust. And next. Of course, we really need to work on capacity building. Next. Of course, a lot of research and innovation has to be done in this area. We have to really establish a national mental health research agenda. And I was just going through one article which was published in September after G20, and I've seen that G20, G7, and the BRICS nations, they have really not talked about much about this mental health issues in the subcontinent. Yes, next. I think these are infrastructure, capacity of facilities need to be enhanced. And next, I think I'm done. Last, intersectoral collaboration. Again, WHO has been talking about intersectoral collaboration, and which really need to work for the betterment of the mental health initiatives. Right. Next. I think it's done. Yes, we can complete. These are the key takeaways. We can end up over here. So the basic thing which I really wanted to stress upon here is, I mean, we really need to think about the mental health challenges across BRICS nations and primarily India. And we really need to do a collaborative effort. Policymakers need to be told that we really need to work for the mental health initiatives and uplift the well-being, mental, physical, spiritual well-being of the people so that they can become more and more productive. That's all. Thank you so much. Sorry for taking little more time. Thank you.
Thank
I can't
you.
hear.
And don't worry, you will have a little bit more time later when answering questions. We have a couple for you. And it was a
Thank you.
very, very interesting lecture. Actually, I was shocked with the percentage of people that have mental issues and how mental issues, they kind of there's a retroalimentation process between how mental health impacts directly in economic growth, violence, and several social issues. This was very, very
Yes.
interesting. I had no idea about that. And actually, I would like to welcome to our panel, Dr. Vikas. He was unable to join before. He will actually complete and wrap up the first presentation about opportunities and challenges of artificial intelligence in healthcare. Because we have some time limit, please just limit your speech to 2-3 minutes, okay? Thank you so much. You have the floor.
Thank you, Priscilla. It's really a pleasure for me to be invited to speak at the 7th BRICS Conference by University of São Paulo. It's really a pleasure, and I'm very happy that I could listen to Dr. Gupta, Jaskaranji, my worthy faculty member from and Dean Research, has already made a presentation. I, as Vice Chancellor, I'm heading multidiscipline university in India. And the topic, is of great interest to me because I personally believe I basically belong to area of management and STEM area engineering. I personally believe that the BRICS, all these countries, they have similar opportunities and challenges. We are some of the fastest, growing economies, which are already good in size. But the public health, has still a lot of challenges and opportunities for all the, experts with us. Especially, as Vice Chancellor, when I look at it, I see lots of opportunities in healthcare sector. India being one of the young countries, I personally believe that in the years to come, like India is known for kind of IT services exporter, I personally believe in years to come, India would have another big opportunity of, care sector or healthcare, professionals exporter, those kind of HR, human resource exporter, So if I look at this problem, because, this is something which is actually a very crucial issue. I believe the challenges can also be addressed if these countries of BRICS, they join hands together, as Dr. Gupta was mentioning, that finance, funding, availability of trained resources, that's a challenge. And this challenge is actually, across all the BRICS countries. I personally believe, the health inequalities are big there. There are a lot of, there are infectious diseases, but a bigger challenge, I believe, is non-communicable diseases like, blood pressure, like sugar, which is increasing at a very fast pace. They are more to do with I would say, lifestyle of people. And healthcare infrastructure, the infrastructure as such is again, in a country like India or all these, BRICS countries, which are generally good in population size as well. So these countries have this, infrastructure challenge. I believe a little more political will, can bring some solutions, to these kind of issues. When I say this, what I mean is that, like Dr. Gupta was saying, funds, availability of funds, maybe all these countries which are representing the growing economies, we can create a healthcare fund, or we can create some common infrastructure. And the IT expertise of Indians, the Indian young kids, we are now second largest country, coming out with number of, IT engineers in the world. So that is why, Jaskaran and I had this discussion. And artificial intelligence, I believe, with this increasing use of AI, Jaskaranji must have presented, in his presentation how AI can be of use. But I personally believe that if we use IT interventions, if we use the IT capabilities, which are also growing at a very fast pace, just like BRICS countries are growing, IT infrastructure, IT capabilities also growing very fast. So if we look for more and more such opportunities where artificial intelligence can be used, maybe like for predictive analysis, we call it, or in fact, with the use of all these smartwatches, even the enhancing, diagnostics capabilities can be used. With the help of AI now, we can think of personalized medicines. Maybe a lot of administration of healthcare can also be run using the AI infrastructure. So for me, if you ask me, Priscilla, I personally believe that it's difficult to have so many doctors, so many, as Dr. Gupta was mentioning, so many psychiatrists, clinical psychologists. Increasing this number is going to be far more challenging than maybe looking at the opportunities where IT interventions can be done, use of computers, use of AI can be done, and things can be made more manageable for the public and large population of these BRICS countries. Thank you so much, Priscilla. I believe I have just taken little more than 2 minutes, but so kind of you. I'm so thankful to your university, yourself, for giving me this opportunity and interacting with the large audience of this 7th BRICS conference. Thank you so much. Thank you so much. Very kind of you.
We have Dr. Jose Ferran, with whom we have a memorandum of understanding, who is the president. Yes, sir. So who is the president of Brazilian Association of Legal Medicine and Forensic Sciences, and now the president-elect of Latino Americana Association of Forensic Sciences and Legal Medicine.
Exactly.
Yes, sir.
And I'm so thankful to Dr. Jose Ferran for allowing me to come in between and
Don't worry, we will just continue our debate here. And thank you for summarizing the first panel and also linking with the second one. That was very interesting. And as Dr. Jasper already pointed out, our next speaker is Dr. Josephan Freire, our Brazilian representative. He is the president of the Brazilian Association of Legal Medicine and Legal Expertise. He has a postdoctoral and a PhD from the University of São Paulo, and he has a master's degree from Unicamp. He is a specialist in legal medicine and medical expertise. Dr. Josephan will explore the social representation of legal medicine in his speech. Please, Dr. Josephan, you have the floor.
Thanks for all. You heard me? Okay, the sound? Okay. And initially, I pretend to thanks to the board of the GBRICS, my invitation to the 7th conference of the conference of the BRICS, and you, Priscilla, for your care, attention, and kindness with us. And for all of our colleagues in that panel. And my presentation is different in a specific aspect, because it's a philosophical and epistemic approach to representation of the social representation of the legal medicine. I started okay? No?
Not yet.
Not
Do you
yet.
prefer that I share my screen?
Yes.
Okay, I'll do that.
Eu usei aqui. Okay. And I started that presentation in a theme, a topic, the social representation of legal medicine. And that topic is based in a work, in a specific work of Serge Moscovici. He was a very important philosopher and thinker in the Europe, and that concept of social representation is created for him, and it's very important to understand our activity, the legal medicine and the forensic medicine. And I appreciated that information of my friend, the Jaskaran, is really, we created the Latin America Association of Legal Medicine and Medical Expertise and Forensic Medicine, and I was elected the first president in the Latin America. And the social representation of legal medicine is, for to talk about that theme, is necessary a visit to the creator of the sociology, the concept of sociology and the science, social science. And that thinker, that philosopher was Auguste Comte in the 19th century. Auguste Comte talk the first, yes. The social science by Auguste Comte is introduced, among other science, must provide a group of beliefs that are indispensable for social organization. The scientific spirit without sociology will be purely critical and negative, and the studies of social facts not supported by other science would be full of arbitrary statements. Therefore, thanks to the union of these themes, the problem of reorganization social would be resolved. For social progress over scientific progress means increasing the solidity of social institutions through the sociological complement given to the science. Progress that assures men more power over nature. That text of Auguste Comte is in a book of Émile Brie, in the page 460. The next, please. There are three important philosophers in the beginning of the sociology. Auguste Comte, Émile Durkheim, and Max Weber. The second in importance with the study of the social representation of the science, in our case of the legal medicine, is Émile Durkheim. And Émile Durkheim present in your text an association with a dialectic Platonic Hegelian, and the summary of that concept is, in effect, depending on whether the parts of which the people is the address are composed are more or less numerous and are ordered according to this or that plan. To this or that plan is very important, that phrase. The nature of the collective being necessarily varies, and consequently its ways of thinking and acting vary, and demonstrate the variety of the themes and the topics and the necessity to the ideas of the social representation and the sociology. The next, please. Émile Durkheim, in other book of sociology, talk about the physics of customs and law, aims to study moral and legal facts. These facts consist of rules of sanctioned conduct. The problem that science faces is to research, first, how these rules were constituted historically, that is, what causes gave rise to them and the useful purpose they fulfill. And second, the way in which they function in society, that is, in which they are applied by individuals. And Durkheim think and talk about the comparison in between the people in the live in the society and the environment, society environment, and the environment for the individuals. Next, please. And the create of the concept of the social representation was Serge Moscovici. And the definition of that concept is: social representation are almost tangible entities. They circulate, intertwine, and crystallize continuously through a word, a gesture, or a meeting in our everyday world. They permit most of our established relationships, the objects of produce or consume, and the communications we establish. We know that they correspond on the one hand to the symbolic substance that goes into their elaboration, and on the other hand to the specific practice that produces this substance. In the same way as science or myth correspond to a scientific practice or myth. And the social representation in the legal medicine and forensic science is the way with the people see our specialty, see our service, see our explication to the phenomenon. And Serge Moscovici described with the more strength that social representation in all conception of the science. And is that concept is more important to our profession, our science. The next, please. An example of the social representation is possible in a book, in a work in the 1621 to 1605, when Paulo Zacchia published a book, Questões Médico-Legais. In that book, Paulo Zacchia put the concept of otherness and the law, the ethical medicine on the relationship was the medical doctor and the patient. And Paulo Zacchia put in our profession the concept of otherness. The otherness and, for example, the society, the group, the nations, and the society. And treat in that book many topics, many different topics. Age, illegitimate birth, pregnancy, becoming pregnant again, idatiform mole, cause of death in childbirth, the similarity and dissimilarity of the unborn child, impotence seundi and generandi, the simulation of disease, plague and contagion, miracles, virginity and rape, fasting and Lent, mutilations, water, air, place, medical error and respective punishment, doctor and expert relationship, the concept of monsters, the divine office, marital debt, the stigmata of the magicians, the monastic cloister and the responsibilities of the coroner is a very different topics treated in one book, and Paulo Zacchia get treat that different topics when one idea, the idea of social representation of the legal medicine, and the name legal medicine was created for that colleague in the 17th century, Dr. Paulo Zacchia. The next, please. Reading the experience is a concept of Jean Piaget, who is a biologist, a very, very important biologist and scientific, and create a new science. And I study Jean Piaget in my doctorate, and I like a lot the study of the work of Jean Piaget. Moscovici, in the view of Moscovici, a difference in seeing the social representation of forensic medicine. I was the concept of reading the experiences, that concept created for Jean Piaget. In other words, we perceive the world as it is, and all our perception, ideas, and attributions are responses to stimuli from the physical or quasi-physical environment in which we live. What distinguishes us is the need to evaluate beings and objects correctly, to understand the reality completely, and what distinguishes the environment is its autonomy, its independence, with respect to us and our need for desires. What were seen as cognitive biases, cognitive distortions, affective tendencies, obviously exist, like us, We are aware of this, but they are concretely beyond distortions and tendencies in relation to a model to roles taken as the norm. Moscovici teach us about that concept of the Jean Piaget reading the experience. The next, please. A quick story on two persons to talk about the social representation of the specialty. Gandolfi in 1862 talk. Legal medicine is the science whose object is the application of medical principles, justice, and philosophical analysis of physical, moral, and social elements of men that serve as the basis and the ordering of institution and the reform of some laws. Gandalf emphasized the philosophical concept of legal medicine. Alexandre Lacassagne, in 1978, talk. The profession is learned through patience and work. Science is acquired through study, but art derives from instinctive natural qualities. Those who have it are not men. And Lacassagne emphasized the importance of the professional and the art. The next, please. The social representation of legal medicine under the vision of the Immanuel Kant and the concept of phenomenon. How do we interpret phenomena in the experience of legal medicine? Kant talk about that with the definition that phenomenon is the most elementary element, most elementary in our conscience. And the doctors, the forensic doctors, treat of that concept every day, every hour, in all work, and because that doctor interpret the phenomenon and put the phenomenon in the legal and in the law and the jurisprudence and the explication to the world, the explication to the life. And the scientific view of the social representation, that concept, is based too in Aristotle, because Aristotle treated the structure and the conceptualization of scientific evidence. And the concept of evidence, the concept of structure, the concept of tendency, trend in English, from the Aristotle, and your importance to that knowledge, in case our knowledge in legal medicine and forensic science. The objectivity of everyday life and the social representation of in the specialty is there are one character, is the nomological character, so the normative, the legal, that jurisprudential character, and that our activity contribute to the creation of the laws, norms, and resolutions to use in the common life. The next, please. How does society view forensic medicine from a historical perspective? In the primary, the society view the forensic medicine with a dark medicine, and the deaths, the treat the deaths the lesions, the violence. It's in the beginning, the dark medicine. Today, there are a very big importance because it's necessary, that science necessary to ordinate the social comportment, and that because that there are a social representation very important to the society. As is true, an expression of medicine and the other science, empirical sciences, and for example, chemistry, physics, the linguistic, the logic, the biology, specifically today, the most important area is the genetic and the new concept of the practice of our specialty. Is the legal medicine and forensic science an instrument for the practice of the law? Yes. It's very big and important instrument because about that there are many studies, and it's very important to emphasize which that instrument produce the evidence, produce the proof of in the process, and the management of the evidence of the proofs is the real good practice in the practice of law, and including the concept of justice. Justice, treated by John Rawls in a book, a theory of justice, and that book Rawls teaches us about it. Justice is the major benefit with need a society. As the legal medicine and forensic science a need, a social need, yes. If we don't need the proof, the evidence, and the science to constitute the proof of the evidence, the injustice is the real practice. And all that is science, as a facet of the science, focus in social group, not in relationship doctor-patient, but social group. To the society is the address to that work. I think I use my time in really my time.
Don't worry, you have 5 more minutes. 5 more minutes.
Okay. And I think the social representation of legal medicine is a theme of in our Congress. The people don't treat that idea, that concept, this concept, because the work of Serge Moscovici isn't not used, recognized in our group, in our profession, especially in our country, because is that study is understanding in our society with a theme specific of the sociology of the philosophy, not the legal medicine and the forensic science. But it is a mistake, because our profession work in the society, work to the society, work to the law, work to the good practice of the law and the justice, and is necessary legal practice of the profession of the legal medicine and science forensic have that knowledge, because it's a very important to interpretation to the phenomena, the social fact, the social phenomena, and the application of the laws in our society. And we, in that area of knowledge, the legal medicine and the forensic science, we construct the proof, construct the evidence, and the evidence and the proof is possible use that concept is possible to make a very good application of the law. And about that, our conversation, the next. Thank you very much, the board of the GBRICS, our colleagues, Dr. Jasker and Dr. Vikas, Dr. Anity, and especially thanks to Priscilla to the attention and kindness with us.
I'm the one who thank you for your amazing lecture. I learned a lot about how philosophy, sociology is linked with medicine, and actually a lot of points you explained us has a lot to do with Professor Anviti's explanation, because suicide as a social factor is a theme that is not a contemporary one. But now we see that our societies, they are getting sicker, which is, well, interesting in a bad way. And the first speakers, Dr. Jaskaran and Dr. Vikas, they can actually bring solutions by inserting technology in this field as well. Now we have a little bit, we have 15 minutes for answering questions. So I know it's really late in India, but if you want to continue and debating with us, I actually have several questions for all of you. I will start with Dr. Jaskaran and Dr. Vikas. And the first one we have is about, does India can collaborate to share technologies in medicine with other BRICS countries? Do you have any initiative, any program to share all this knowledge that you guys explained us and show us that are applied to medicine in other BRICS countries? Thank you.
Yes. I just wanted to apprise, if I talk about the Gita University, where we are working under the mentorship of our Honorable Vice Chancellor, Dr. Vikas Singh sir. So we have, already signed an MOU, Memorandum of Understanding, with University of São Paulo, the Medicina, the Department of Medicina, and the Institute, Oscar Institute of Ferrari, under the esteemed guidance and collaboration of my brother, Dr. Jose Ferran. So we have already signed an MOU with the Brazilian Association of, Legal Medicine and Forensic Sciences. So together, me and my Honorable Vice Chancellor of Gita University, we both are in collaboration with University of Sao Paulo and the Brazilian Association of Legal Medicine. So definitely we are chalking out certain projects, and in near future this technology aspects will be the futuristic one to become a benchmark in between two countries, Brazil and India. Definitely.
That's very interesting. And in the same field, we have another question here from the public that says, at the BRICS summit in Johannesburg that just happened, intentions to form an artificial intelligence study group within the BRICS member countries have been announced. This initiative aims to monitor the progress and development of artificial intelligence technology closely. How can this initiative contribute to monitor progress in the field of health? Again, a question for Dr. Vikas and Dr. Jaskaran. But of course, Professor Anviti, if you want to join, you are welcome, and Dr. Jaskaran as well.
Thank you. Thank you.
Yes. So I again just wanted to apprise you. Yes, artificial intelligence is something, these are, as I have included in my presentation, that it's a trained models. It's on whole soul entirely dependent on the data sets. So yes, of course, the artificial intelligence has to be monitored. It has to be rigorously, you can say intervened with human interventions. So yes, it's very, very important that it should be under control guidelines, because artificial intelligence is something which, when used in healthcare industry, has to be monitored very vigilantly, as I have discussed in the presentation. So it's very important, like in the last where the BRICS conference was happened. So yes, it has to be monitored. So it's very, very prudently monitored and very robustly, justified that what tools and what algorithms and what models are being used for healthcare industry.
I would like to, if I permitted,
Please,
I would
go
like to
ahead.
add one thing regarding AI. And there are recently a lot of AI powered tools are being used to manage a huge data. Like in mental health, also we can identify the behavioral pattern, right? A lot of behavioral patterns, then the speech of people, the text they write. So AI tools can help in making a diagnosis and making a prognosis, as well as in carrying out various interventions for these things. So AI is being used in mental health issues also. And though we have yet to start, we've yet to begin with this, but a lot of work is being initiated in this area as well. So when you were talking, Professor Jaskaran, when you were talking about AI and healthcare, so I was also very, kind of happy to know that, yes, we can also collaborate with you as far as AI tools are concerned in mental health sciences and psychology, basically.
Definitely, ma'am, for sure. Definitely.
In linking with this healthcare, actually the public was very curious to know, Professor MVT, what types of mental disorders increased after the pandemic in India? Have you guys seen a change? Has it stayed the same?
Yes. See, pandemic gave birth to isolation, less of personal touch, physical touch, more of this technology was used to communicate. So socializing became lesser. People were isolated in their homes, and lot of cases of domestic violence, aggression in children, aggression in these spouses came to the forefront. And we got to know that many divorces happened during this period, because when two people who are out the entire day in 24 hours, and they interact less and less, but sometimes when you interact more, you get to know more about the people, right? So when you get to know more, either the understanding is better depending upon people's personality. If understanding is not there, more of clashes will happen. So more of physical proximity reveals people's both bad side and good side. So if the other person is tolerant, you can learn to tolerate and you can learn to coexist. But if it's the other way around, which is now the case in the modern world, which is becoming more and more complex with the competitiveness, with lot of aspirations going out and climbing up the ladder of success in your professional lives, I think there are a lot many clashes between different personalities. And the biggest the cases which came in front of the counselors, or the need was felt that somebody should be there to talk to people who are isolated in their homes. They are away from their homes. They are living separately from their families. Now they just have a telephone or the internet to talk to. So they needed somebody with whom they can really do a catharsis, vent out their precipitating problems. So domestic violence was increased, divorce rate gone up, more communication led to problems, and less of socializing, less of intermingling with people also, and isolation also gave birth to a lot of problems. And in children, it was seen because they were not going out and playing with their peers. So a lot of aggression, anxiety, and depression issues also came into being. Pornographic addiction in children was also seen during the pandemic era. So yes, it put forth a lot of challenges in front of the mental health professionals, and the government was really asking to prepare a long list of people who can be a mental health professional, can do counseling, can do telecounseling. So telecounseling came into being after pandemic. So this profession nowadays is really given a lot of importance, because we really need to combat with the mental health issues. If we are not settled with the mind and the heart, we won't be able to produce, we won't be able to have a good relationship, we won't be able to be happy, healthy. So a lot of positive psychology interventions are being done. So people are not learning to be compassionate, empathy, gratitude. These things are being taught to the masses, that they have to be thankful. So it was said that if you are alive after pandemic, I think you have to thank for every good thing. So gratitude is very important. People don't even know how to thank. So these are the things, these were the many challenges which now also we are now see. Now what was happening? People were relying for education on online mode. Now they got used to in those 2 years for online. Now you're telling them out, come out. Now they want to go back to that easier mode now. Now it's becoming a challenge again. Right? I hope I answered my the
Yes,
question.
yes, very completely. And actually, this
you.
has a lot to do with what Dr. Vika said in his intervention. One of the challenges is the lack of professionals.
Yes.
We need more doctors,
Yes.
psychologists, psychiatrists, and other health professionals, and mental professionals, of course.
There's one more thing I wanted to add here, Priscilla, if the time
Sure.
permits. That, see, we do have clinical psychologists, but they are less in number. But we do need counselors, psychologists also, because there are non-clinical patients and there are clinical patients also. But the percentage of normal people who are just sitting near you, they are having enough number of problems. Just anxiety, depression, loneliness, mental fatigue, OCD, paranoia, phobia. I mean, these are the non-psychotic diseases which can be treated by counseling sessions. So we need people who are the counselors, the psychologists, as well as we need clinical psychologists and psychiatrists to deal with the clinical population suffering from maybe delusional disorders, then schizoid personality disorders, or schizophrenia, to name a few. Thank you.
Perfect. Now, I would just like to ask one more question, and this one is for Dr. Zoja from Freire. And it is this one. Social representation of medicine seems to be a multicultural concept. Do you see any possible collaboration among BRICS countries to develop legal medicine? I will do some translation, okay? Here, okay? Professor Dr. José Fran, a pergunta que foi dirigida ao senhor foi se a representação social da medicina parece ser algo multicultural. Você vê alguma possibilidade de colaboração entre os países dos BRICS para desenvolver a medicina legal?
Yes, it's necessary to all countries contribute to that knowledge, because the practice of the crimes and the violence and the many kinds of violence, physical violence, mental violence, sexual violence, is unfortunately present in many countries, in the majority of the countries. And the contact of the BRICS is our proposal. This contact of the BRICS, the G-BRICS specifically, is possible to make many journeys, congress, conference to the knowledge, to know that situation in each country, and the possibility to share the problem, share the solution, and propose the possibility to many proposals of the treat that situation in each country, in our country, Brazil, in Latin America, in all America, Europe, Asia. Is the problem exists and is needed very big and rapid solution. And I think the contribution to the BRICS in that kind of knowledge is very important. Yeah, unfortunately, don't have it. Our colleagues don't know that situation in the BRICS. Who is the reality in that countries? It's necessary change the experience and change the solutions.
Thank you so much. Now we have about 2 minutes to wrap up and say goodbye. If you guys want to add something, the floor is yours.
Thank you, Priscila. Thank you, the board of the G-BRICS. And another time, falando para você em português, vamos ver se conseguimos fazer um bom evento sobre este tema aqui no G-BRICS.
Perfect. We will be doing other events about this theme eventually.
Priscilla, I would like to, add just a small thing, Dr. Aditi. My point is that, there has been questions about collaboration, between different universities and between different countries. I believe, first, we being teachers, we need to, I would say, collaborate more initially to understand the opportunities, the challenges, which we all are facing. And maybe then we can, prepare some policy documents, some supporting documents to our state governments, to our national governments, because Priscilla, you asked a question, regarding the, initiative by governments, for that collaboration. Somebody asked that question. So my point is, initially, because BRICS is a old, I would say, platform now, but I think teachers, we need to, collaborate more, understand the issues more, and we have our own competencies, we have our own strengths, university by university, professor by professor, department by department. I think we can, collaborate in a big way, and we can really produce some, some interesting, outcomes. And then, of course, we can look at the bigger, I would say, picture. I have a very strong team. Dr. Jaskran, he's sitting here, is my head of the forensic science department. He's also heading, the research department. You have seen Dr. Gupta and, her thorough understanding of the, issues. So I believe, and my, I'm also speaking to the audience which is present right now, that we should look at each other, their strengths, and then we can forge some collaborations, which can then look at these wider perspectives. This is what I wanted to add, Priscilla.
Yeah. May I, with
Thank
your
you so
permission, Priscilla? Yeah, I really ditto Dr. Singh's, who's the Vice Chancellor's viewpoint that we need to collaborate, understand, and then we can paint a bigger picture for the masses, for the society, and India, where new national education policy is totally based on outcomes. So, outcome based things we have to think. So, what better forum than collaboration, wherein we have the best of all the worlds and we can attend to various problems which we are facing in education system, in forensic science and legal aspects, and me being a psychologist and a counselor at heart. So how to attend even the forensic, we have a forensic psychology paper. So we really need to study about the psyche or the mind, how the cognition, how the processing of the criminal works, why he commits suicide, homicide. So we have to basically understand human behavior, human psychology first, and this platform of BRICS and collaboration of Indian universities amongst themselves and collaboration with the foreign universities would definitely give us an edge to tackle various problems where the initiation or the initiator of anything good is human mind, human behavior, and initiation of anything good also is human mind and human behavior. So let us study together. There can be new areas, vistas, avenues of research, of collaboration, innovation, and policy decision which we can give to the authorities and the government of all the countries. And these basically, as I told you about these three governance bodies of G20, G7, and BRICS, that what policy decision can be taken. We have lot many people who are intellectuals. They are individually doing a lot of work of research, but then we really need to collaborate and have a bigger impact on the society. We are missing that bigger impact. Individually everybody is doing in their own areas, but that bigger impact and a larger group can be attended to. So that is where, as sir very rightly said, we really need to collaborate. Even Sharda University here in Greater Noida is looking forward for various MOUs with the universities, collaborating for faculty exchange, student exchange, and research, especially collaborative research, because there are cultural differences. How we can attend to a problem, even we can study the impact of culture on the human behavior, on the innovation, on the forensic laws and all those things. So how these things, and sir Josfran sir very beautifully told us the sociological philosophical aspect of the law of forensics. So that was really an eye opener, because I do have one of the departments working under me is Department of Sociology. So I can give them that piece of information today that they can do a lot of work in this particular area. So we
That's
have to
perfect.
learn from each other, learn to coexist, and learn to go ahead. So collaboration we are in for from my university. And of course, Dr. Vikas Singh sir, we can collaborate amongst ourselves, and then we can collaborate with the esteemed university who has invited us. So
GBRICS is always ready
heartfelt
and
thanks.
always open for collaboration. This is the key
Thank you.
term, collaboration, because we
Yes.
have a lot to share.
Same here.
Unfortunately, our time came to an end. I will just give like 30 seconds for Dr. Jaskaran just say goodbye, and then we will end this transmission.
Yes.
It's a pleasure.
Thank you so much. Thank you so much, Priscilla, for inviting in this particular BRICS conference, which was an amazing experience for us. And thanks to Brother Joseph Ferran, who has, a mediator, and who is my brother, who has always, a motivator and, a enthusiast, towards research, technology and all. And I hope me and my Honorable Vice Chancellor, we both have, given our best in delivering the presentation on AI in healthcare industries, deliberation on opportunities and various challenges. So thank you so very much, Brother Josferan, and thank you so very much, Priscilla, the BRICS, and for inviting us and inviting in this particular good and amazing platform. So thank you so very much, and thanks to my honorable Vice Chancellor, sir, Dr. Vikas Singh, sir, who have spared his precious time in this presentation and in this particular conference. And thanks to Professor Anviti ma'am, definitely, and we will be collaborating, and we will be chalking out certain aspects wherein forensics and psychology can culminate, and we can work together to study criminal minds. Thank you so very much.
Thank you so much, everybody.
Thank you.
And
Thank you, Priscilla. Thank you, Josferan sir. Thank you, Vikas sir. And thank you, Dr.
Thank you
Jaskaran.
for our
Pleasure.
public who
Thank
stayed
you.
with us until now. Thank you so much. And don't forget that our conference continues tomorrow with a lot of other panels with very interesting subjects. Thank you, and see
you so much.
you guys
Thank you.
tomorrow.
Thank you.
Thank you.
Bye.
Thank you. A hug
Thank you.
from
Bye-bye.
India.
Bye-bye.
Bye.
Thank you. Thank you.